some people choose to cut their hair short or buzz their heads rather than experiencing the hair loss that can come from chemo. And that, the buzzing of your head, that's a big step. And it can be both bold and uncomfortable. And for anyone who wants to proactively cut their hair before the chemo makes it fall out, how much time do they have to do it?
Oh, yes, this is very important because studies have shown, Dr. Weiss, that when people cut their hair before they start losing it and seeing it down in the drain and the shower and the pillow is less impactful. So psychologically, to be prepared for this, cutting the hair would be preferable if one is not using any treatments to prevent hair loss, like the scalp cooling devices that may be available in your area. You would have, from the time of diagnosis, the time of chemo, it takes about 2 to 3 to 4 weeks from the first chemotherapy. I would say that you will not lose hair after the second cycle of chemotherapy, so another 3 weeks or so, 2 to 3 weeks. So you have about a month to prepare. What I have heard, because I have not experienced this personally, is that when you arrange for it and becomes like a celebration with friends and family, it's actually much better tolerated or received by people.
Let's talk about ways that people can reduce their hair loss. And you mentioned about the cooling cap systems, the cold caps, that it can be done with a machine, or the manual ones that you have in an ice, on liquid nitrogen. I mean, the CO2, and then you change them up throughout before and during and then after chemo. Why don't you tell us how those things work and how well do they work? And what are the barriers to utilizing those technologies?
Sure. So this is something that's very important, right? Because it really can change the way that people approach chemotherapy, as it has shown to be beneficial in about 1/2 to 2/3 of people. So what is this whole concept of scalp cooling? Well, the concept is that if you, during your chemotherapy, starting 1/2 an hour before and then an hour to an hour and a half after, you on your scalp, you are wearing this gel or this device that is very cold because it either has been frozen, as you said, or because it's connected to this refrigerator-like device that circulates a very cold liquid into your scalp. What that does, it will shrink the blood vessels in your scalp. Think of what happens when you go out on a very cold night and your fingers get very cold, right? And also it reduces the metabolism of hair follicle cells. And one way to remember that is think what happens when when they transplant organs, for example, and they transfer them in an ice box, right? So cold makes tissue survive more. So by doing that, what has been found, and this has been published in major medical journals like the Journal of the American Medical Association, is that up to 1/2 to 2/3 of people that undergo this treatment will retain the majority of their hair, and they will not need any camouflaging method like a wig or a turban or a hat. And they are effective in about at least 1/2. There are some limitations, however. There are some treatments for it may not work as well, but it still works. So what I like to tell people, and people are very grateful about this, is even if you think it's not going to work with your particular type, at least try it a few times. So at least you feel, like you said before, that there is that sense, Dr. Weiss, of having control. Okay, you tried it, and at least you gave it a shot. And whether it did or did not work, because we have been very surprised to see some groups of patients in which it was not supposed to work to actually work. Now, that comes to the limitation, right? What are the limitations? Is that they may not be accessible everywhere. So I would encourage you to consult your local oncologist to see if they offer them, and also cost. I know that cost can be a barrier. There are some organizations that provide financial support. And I know that increasingly insurance companies are actually covering this. So it's important to discuss this with your care team prior to starting.